This video is for those potential patients and even hair transplant doctors who feel that delegation of their surgical responsibility is fair game. Hair transplantation, though often presented as a routine cosmetic procedure, can throw curveballs or googlies that can test the surgeon's training, his composure, and his presence of mind. And one such challenge is the presence of an AV malformation, arteriovenous malformation, in the skin of the scalp which is being operated upon. These congenital tangles of arteries and veins bypass the normal capillary bed. They join with one another directly, creating fragile, high-flow blood channels prone to massive bleeding and vascular instability. What makes AVMs more hazardous in hair transplant is the fact that they do not always announce themselves. Most of the cases, the scalp will show a pulsatile swelling, a swelling that throbs with the beating of the artery underneath, which is abnormal. It can show as a bruit, that is a sound, a thrill, which on feeling you can feel a thrill, or discoloration like in this case. But in other cases, they lie silent beneath the skin, invisible to the naked eye, betraying no clue whatsoever until the moment of surgical engagement. Like an iceberg below calm waters, where danger lurks in what cannot be seen. So a technician doing a hair transplant, clueless about medical knowledge, about the presence of AVMs, may only realize when it's too late, when the blade or the punch hits an AVM, and in utter consternation meets a gush of uncontrolled bleeding, which doesn't stop. And at such moments, immediate intervention is required, and only a doctor trained in surgery can act decisively at the moment and save the moment. The surgeon's role begins well before the first incision. A qualified physician first takes thorough history, inquires about past swellings, headaches, previous interventions, does a proper clinical examination, and when suspicion arises, will get a Doppler ultrasound done, or may even need MR angiography. Yet even with meticulous evaluation, some AVMs reveal themselves only during the surgery. And this is where surgical judgment, honed by years of surgical training and crisis management, becomes the decisive factor in saving the day. Quick hemostasis, stopping blood flow, altering the surgical plan on the spot, or even aborting the procedure may be the safest course. In rare but severe situations, referral to a neurosurgeon or an intervention radiologist for embolization or staged management may be necessary before taking up the patient for a hair transplant surgery. And here the priority shifts from cosmetic enhancement to patient safety. The patient expects new hair. He is oblivious of the fact that danger lurks. But the doctor must first safeguard his life and his vascular integrity. And this scenario sharply highlights how hair transplantation is not a mere beauty service, but a surgical specialty. The risk posed by an occult AV malformation illustrates the gulf between a technician-led setup and a doctor-led clinic. And many technician clinics operate under the garb of being doctor-led. We all know that. A non-medical operator who focuses himself on speed, because he has several cases to do that day from clinic to clinic, he focuses on graft numbers, simply cannot recognize, because he's not seen the patient before, simply cannot recognize or anticipate an AV malformation, least of all manage such a crisis. But by contrast, a trained plastic surgeon or even a dermatologist draws on deep reservoirs of anatomical and clinical experience to navigate the unexpected. In my opinion, difficult cases like AVMs reaffirm the central truth of our profession. Hair restoration is not merely about placing grafts, but about treating a patient. And when pathology hides in plain sight, it is a doctor's vigilance, it is a doctor's wisdom, and rapid action that ensues that can spell the difference between a safe outcome and a disaster. And there are many such untoward incidents that have happened in the past. And that is also the reason why the government, especially the Indian government, insists that hair transplant procedures should be done either in a hospital or have a hospital as a backup. A calm sea never made a skilled sailor. And in a hair transplant, it is precisely such storms that underline why only a qualified doctor should be at the helm. Well, thank you for watching. If you have any questions about hair transplant, about hair loss treatment for men and women, do let me know. Leave a comment in the comment section below and I'll reply back to you shortly. Have a nice day and God bless you.